Another Facebook Live event with Autism Lifeline links. Today we are hosted by our good friends, Autism Community Network, and we're so excited to be here. Also in the room, live streaming, we have Any Baby Can, Southwind Fields, Down Syndrome Association of South Texas, and of course Autism Community Network. Please do submit questions through any of those sites that you're watching on, or through the Autism Community Network site, and we will get to those as soon as we move through the day. Mm-hmm. So again, Autism Lifeline Links is a project looking to, we're doing some technical changes here. So looking to make sure that every person in our community with autism is registered with us and has access to services in the community that are available. It also helps us to make sure that whatever services are not available or wherever waiting lists are, we can really look to try to implement change in those areas. So today, as I said, we're here at Autism Community Network with Dr. Berenice delaCruz and Adrienne. I was like Adriana and I was like Adrienne. So Adrienne, that's Gaither. And we're gonna just dive in a little bit. Our subject today is toilet training. We know that toilet training for children with special needs, adults with special needs, and even neurotypical kids is always such a challenge. I think every parent can reminisce about the stories or maybe some guilt or some grief they got from a peer or a friend or from even social media about when a child should be toilet trained and what the success should be and how long it should take. The fact of the matter is it really is a very individual thing, but we want to make sure we're spending some time today to talk about the history of toilet training, what happens in school settings, making sure everybody's on the page from inside your home to outside your home and whoever's caring for your child. And then talk about some readiness issues, because I think we all know if you start too early, you could really get into a whole lot more anxiety than needs to be there.
Or we'll be talking about that.
And we'll talk about that. So I'm going to turn this over actually now to Dr. delaCruz, who is going to give us a little bit of the history of how toilet training and kind of like why is this, why do we do this? Why is such a hubbub?
Well, I think it's really important to talk about the history of toilet training to really kind of figure out where we are today and how that impacts our ability to be able to toilet train children, specifically children with autism. So just, there's different tribes around the world, there's different countries that even now are really starting to toilet train children, babies, before they're 1 year of age. And I think if we think about that now, that seems kind of strange, right? We don't really think about starting to toilet train a baby. Right. We think about them as they're toddlers. Yeah. But just for us to kind of keep that in the back of our heads, and that actually was the case in the 1920s here in the United States. Sure. Where we were talking about toilet training your baby. Yeah. That was something typical. And then in the 1930s, 1940s, we had the invention of the
disposable diaper.
First washing machine.
Oh!
First we had the washing machine.
Okay. Yeah.
And so then people started talking about, well, they don't have to be so little, right? They can be a little bit older. And then we did have, in the next century, disposable diapers. And so now we're talking about readiness. That's really when we began to talk about readiness skills, because before, people were not talking about readiness at all. It was just, this is a high need, we are going to toilet train our babies. Wow. And so it's really interesting. And I ask parents all the time, with my own children, I think about when my pediatrician asked me if they were toilet trained. And it's really not until they're about 3 years of age that we're seeing pediatricians ask, oh, is your child toilet trained? Have you started thinking about toilet training them? That seems to be kind of where we are now. By 3, if they're not toilet trained, you should really be thinking about it. For our kids with autism, that becomes really important. In a little bit, Adrienne will be talking about some of these readiness skills. But I want to just get people already thinking about the fact that maybe it's not just all about readiness, and it's all environmental. I'm a behaviorist, right? And so I always think about what's in our environment and how does that trigger how we respond. Sure. And so if we have these things like disposable diapers and washing machines and things that maybe don't make it as inconvenient for us to have our children not be toilet trained, then that's definitely going to play a factor into when we're starting to toilet train kids.
Interesting.
So that is.
You always think of the advent of technology,
yes,
like a washing machine, or then the disposable diaper, and we can sidebar about some disposable diaper issues later.
We're thankful for those things, but
so
we definitely need them.
Thank you. That's really neat. So Adrienne's going to talk a little bit about school and how we manage that, those two worlds, right? Our
Yes.
children are in school in waking hours more than they are with us, and so how do we make sure that we're aligned in that way?
Absolutely. So, first of all, I want to talk a little bit about why readiness is even in the conversation, because as Dr. delaCruz mentioned, sometimes our children who have developmental disabilities such as autism are maybe not going to show those signs of readiness as a neurotypical child may do, or they may be showing signs of readiness and the parents are not really picking up on those signs and thinking, I better run with that, because they're hiding in the corner when they're going to the restroom, or they're pulling their diaper off when it's wet or dirty and they don't feel very comfortable. Those are really signs of, oh my gosh, maybe it's time to move on with this and actually toilet train my child, because it is very possible to toilet train virtually everybody, especially if you think about it from a behavioral perspective, as Dr. delaCruz talked about. Schools. Now, a lot of our children go to daycare before they go to school. Daycares are known for looking at the cognitive age of a child or the developmental age of the child and moving them from room to room. Moving them up is a big phrase. Oftentimes when you move up, though, it's required that you be learning how to toilet train. So what happens is this can hold a child back, certainly in daycare, from being in a cognitively appropriate environment for them, because they're not learning how to toilet train. So that's something to think about when you're looking at daycare. Number two is pre-K. Pre-K for SA, as we know, is a big program here in San Antonio, and we have it for 3-year-olds and 4-year-olds before they get ready to go to kindergarten. But a lot of people confuse pre-K with PPCD, which is preschool program for children with disabilities. And the reason that that's really important is because the federal and state governments define disability as something that can be as mild as a speech delay. And if your child has a speech delay, I understand it doesn't feel very mild to you. But when we're looking at it globally, a severe disability could mean someone who has the very severe form of a certain disease or a disability. So they would go to a program called PPCD, and what's not known by a lot of parents is that this is a program where you don't have to be toilet trained to go to this program if your child qualifies. And in fact, it's part of special education, so your child will receive an individual education plan, and in that IEP or individual education plan, they will put goals for toilet training in their school program. And that is something that must be measured every 6 or 9 weeks. There has to be a plan for the child to meet that goal, and it has to start exactly where they are developmentally with toilet training. So when we think about school, school can actually help us when our child is needing to be toilet trained.
Thank you.
Mm-hmm.
And one of the things I want to just point out is, especially in the traditional daycare settings, a lot of daycares, as Adrienne said, won't necessarily move up a child, or it could become a hindrance to the child even attending a child care program because they do not change diapers after X age. So just want to take the opportunity to point out at programs like Down Syndrome Association and Respite Care San Antonio and Brighton Center. Brighton Center and Respite Care have specialized daycares that are equipped for neurotypical children as well as children with developmental disabilities. They're both inclusive programs. So please know that 2 of our Autism Lifeline Links partners are entities that the potty training, they will work with you on the potty training, but if the child isn't out of diapers by X date, they still will be able to attend at those 2 programs. So I want to point that out. There are a few places in town that really understand the developmental differences there.
Exactly.
Okay, so we talked about readiness.
Mm-hmm.
And now we want to talk a little bit about how do you start to really know? We talked a little bit about, the squatting in the corner, the little bit of shame, the quiet, they're not shame, but whatever that behavior is there, where they're a little bashful about what's happening with their body, or taking off their own diaper. How do we help parents see and understand those big cues, but what are some other more subtle cues. And then secondly, it's a commitment, right? Once you start down this path, you really do need to be prepared. So it's a tough process to start and stop and start and stop. It's very confusing. So let's talk a little bit about some of those cues, and then how do you help parents with that mental checklist of this is what I need to go through in my mind about preparedness before we start.
For sure. Well, Adrienne, do you want to kind
Yes.
of wrap up our readiness and
Absolutely.
then we can talk about the next part of it?
Yeah, I can take that.
Thank you.
Well, certainly we kind of touched on a couple of things. A child who is taking off their own diaper is certainly a big sign of readiness, that they are uncomfortable. So they're feeling the sensation of being wet or dirty on their skin, and they don't like it, so they're taking off whatever is causing that sensation. Also, if you're seeing that your child is able to stay dry for certain amounts of time, and you're sort of able to know what their routine is. You know, for example, you're going to go to HEB at this time, and you know I've got to have them have a diaper change before we go to HEB, because I know this is about the time that it's time for them to go to the restroom or go in their diaper. You're starting to see a pattern or a routine to their toilet training, really. So that's another sign of readiness. Also, if they're having regular bowel movements, and you know, we've all been there with newborns who kind of just go when they need to at any time, there's no rhyme or reason. As children grow and they get to be about 18 months, 2 years old, they start to have a pattern to when they will have a bowel movement during the day, and you're able to sort of predict that. That's another sign of readiness. Also, we talked about babies being toilet trained, and I kind of snicker at that because even in the United States recently, we have a movement of people who are interested in having their babies be potty trained as young as possible. But traditionally, and with pediatricians and the American Academy of Pediatrics says, really at the 18-month, 2-year checkup, we're going to be asking you about toilet training. One of the reasons that I think that's important is because a child is able to hold their own body upright at that time. So whether it's a little boy and you're teaching them how to stand at the toilet, or it's a little girl or a boy needing to sit on the big potty that's in your bathroom, they need to be able to have the balance and the posture to feel secure and be able to do motorically what they need to do to be successful at using the potty.
That's such a good point too, because we know with all children they need that development and that ability to hold themselves up.
Yes.
But that also brings up another really important point that I want to let Dr. delaCruz talk about a little bit, which is the importance of toilet training for, you know, family, for self-reliance, for future participation and stuff. And it's one of those things that when you're in that time, maybe you can't see the forest for the trees, is why this is so important. But it is, and I'm going to let Dr. delaCruz talk about that a little bit.
I think it's really important for us to really spend some time talking about that, because sometimes our kids with autism, they really struggle to get toilet trained. Not always. Sometimes I do have parents who are like, you know, I just decided to not put them in on diapers anymore, and you know, during the weekend they didn't have any accidents. Well, that's great. But I think for most of our children, at least the children on the spectrum, and some neurotypical children as well, that's not always as easy. And sometimes, especially we have sensory issues or other challenges that we're adding to that, it could really be something that you're investing 6 months or more of your life in. And so I think thinking about, okay, yes, I'm going to maybe spend a good amount of time on this, but what is the payoff going to be? I mean, number one, independence, right? We want our children to grow up and be independent. But also, as they're able to be independent with those daily living skills, it puts them in a situation where they're not having to be in a room with other people that might put them at risk for abuse.
That's right.
And that's always definitely, as the kids get older, that's the concern. And then, as you know, when you have a child who's 2 or 3, it might not be as strange to take them to the bathroom and have to clean them. But our kids do grow up, you know, they get to be 10, they get to be 15. I know I've had toilet training classes, I've had moms who have adult children now. And it, you know, they even tell me, we love our children, we all love our children, our own children and the children that we work with. But it can, you know, get to be a very difficult position to still have to take care of those toileting needs. And so as much as we can to devote this time is really, really important. But once you've made that decision, it is something you kind of have to stick with. So you have to be ready. Not only do you look for those signs of readiness for your child, but you have to, as a family, realize that this is going to be some time that you're spending with. For some kids, maybe it's not going to be, you know, as much time, but you at least have to kind of have a devoted week minimum or more and say, you know what, I'm going to kind of change the way my life is going to be a little bit for the next 6 months, if that's what it takes, because this is of utmost importance. And that might play in a role in school as well. It might be that, you know, we don't have as much academic instruction time because we're working on toilet training. And as the kids really progress in this will be, you know, less and less time that they're spending on it, but it's going to be really time well spent.
I think the forest for the trees, the thing that may seem like not
Yes.
such a big deal now, for those of us who are professionally working in the space or people who have loved ones who are now in the adult space of having a developmental disability, these things are so imperative. They're really very important that it gets harder and harder as time in life goes on, that someone becomes more accustomed to,
Yes.
you know, diapers and those kinds of things. So starting at the age that's most appropriate for your person that you're caring for, but knowing that it is a very important life skill and will increase their level of independence throughout the rest of their lives.
And if you're seeing some of these readiness skills, like Adrienne was talking about, where already you kind of see them tucking, or sometimes they will take off their diaper when they're dirty. Over time, sometimes people habituate, you know, like
Yes.
if there's an alarm going off outside and it's just driving me crazy, it's going to drive me crazy. But if I come to work every day for a year and the alarm just keeps going, I might as well just get used to it, or I'm going to be insane the whole time.
Yeah.
And it could be the same thing with our kids. It's like, that was really bothering me, but you know what? I'm wet all the time, so I don't even feel it anymore.
Right.
And doesn't it get to that point sometimes? And of course, not to talk about our kids that already maybe are hyposensitive to stimuli and they're not really feeling it. That just adds to it. But yes, the longer that we have a habit, the longer that it's easy, you know, it's harder to break that habit. So, you know, if we can focus on really teaching children as early as possible. Not to say that, really, I do, like Adrienne said, believe that we can toilet train our children, at least put them on a schedule,
Exactly.
so that they know when they need to be going. That gives them a different level of independence for them, because it's really, really important.
And so one of the things that's also very important is as much about, you said, you know, if I'm going to take these weeks, I'm going to take these months to do this, that it is, it may seem a little ridiculous to involve pretty much everybody in your space,
Yes.
but the fact of the matter is you do need to include everybody in the space, because we have all been in that position where, you know, a child comes home, whether it's from school or from a friend's house or grandma's, and they're in a diaper, and you're like, my God, why is he in a diaper? This is what's supposed to happen. And so those, you know, is there a potty plan? Like, I mean, are there templates that families can use that shows indications for readiness? And then, Mom, you know, dear grandma, we're working on, like, is there anything that are simple Simon tools that families can use to help get everybody else in their world on board while they're making this journey to toileting independence?
I think it's definitely really important to write things out, and while we do have some templates I would be happy to share, I think it's important to really individualize those
Yeah,
templates.
exactly.
Like, for my child, am I deciding that I'm going to put him in underwear the whole time? Is it day and night? Is he going to sit or stand? Is that an option? Am I going to, you know, get really excited and clap for him and I'll give you a sticker? Like, there's a lot of things that we really need to think about, and it is really helpful to write those things out. Talk about it first as a family, write them out, and then share them with people so that, but you have it individual, because all of our kids are so different.
I was going to say, and
You know,
Cheerios may work one day, and then the Cheerios don't work the next day. Or the
Yes,
stickers
or
are
like being
figuring out.
excited. Some of our kids, I remember my own daughter, I was so excited when she went pee-pee on the potty the first time, and I was like, yay, and she was like, whoa. You know, because she doesn't like that. She still doesn't really like it when I clap for her.
It's
so
too much.
you know, then it was a while
sensory
before, and so knowing that and really planning that out and writing it out. But those are really some of the things to really be thinking about.
And I think you brought up a really good point about caregivers who are family members, knowing what the plan is first,
Yes.
and agreeing to the plan.
Yes.
Yes.
It's kind of like other milestones, like getting off of the bottle. doing your homework before you play, those types of things. If you have family members who are caregivers, they need to know what the plan is, but they also need to be on board and be agreeing to that. Or you are going to pick them up and they're going to be in a diaper. And then it causes other disagreements and issues within the family. And that's certainly not what we want to do when we need to have something that's very consistent and repetitive so that this child can be successful.
And so with a neurotypical child, you can sometimes have a conversation, right? You can, and they have oral communication back to you about how that felt, you know, any of those kinds of things. Any extra tips for, again, the nonverbal kiddo in how you're having those conversations and knowing, I mean, I think you can say it's a lot about knowing your kid, right? About what their oral utterances are or what their behavior is, to make sure that they have the ability to express themselves back.
To communicate, to
let
let you know that they need to
they
go
like
to the
it, they
bathroom.
don't like it, yeah.
Yeah, definitely. And I just want to make sure that we remind people that they can go on our Facebook pages, everybody from Autism Lifeline links, all of our organizations, and please submit your questions. That way we can definitely address them and speak to those questions. But it's really definitely important, like am I just going to habit train my child, say, I'm going to take you every 30 minutes and teach you to do that? Or am I working towards independence, which means I'm going to start working on having that child request to use the bathroom.
Correct.
And for the most part, whenever we're working on it, I think our goal is that independence, spontaneously requesting. So maybe we don't focus, if your child has difficulty communicating, you know, and that is obvious because they're not communicating regularly like other kids do with words, single words or sentences, then you might want to still have them request to use the potty, but in a way that's really easy. So if your child is able to imitate and they can make the T for toilet, the sign for toilet, and if you can say, you know, go like this and they can do it, maybe that's going to be your sign. And so you put them on a schedule, you say, okay, I'm going to take my child every 30 minutes to the bathroom. And instead of saying, okay, you know, it's 30 minutes, let's go to the bathroom,
Right,
maybe you have them, like, maybe you would just model it, and then they do that. They signal to you that they need to go to the bathroom. And over time, you want to try to fade that prompt so that, you know, maybe you just kind of wait for them, like, to be like, you know, maybe you paired it with the ding, 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 ding. There's a timer that's been 30 minutes now. What do we need to do now? Really fade those prompts so that they're actually requesting it. And at first, it might not be that their body is telling them that they need to go to the bathroom. They're responding to that schedule. But over time, you're really trying to pair it and work with that. If you have a child who doesn't really have problems communicating, they can just say, hey, I want to go to the potty, you know? I need to go to the potty, and generalize that. And then, of course, there's the word potty.
Right.
You know, when do we say potty? When do we say toilet, bathroom, restroom? What do we say? Yeah, I really think it's important to talk to families about that and what is appropriate for them. And everybody, you know, if a child goes to school, then, you know, when are the other children starting to say bathroom, you know, or do they use the word restroom?
Right.
And for our kids, if they struggle with generalization, for them to know that potty, bathroom, restroom, toilet are all the same thing. So when are we going to work on that? But that's all something that really should be put into our plan so we're not confusing the child. So if your child has trouble generalizing, then don't say potty, toilet, restroom. Pick one.
Yeah.
Start with that one. Work on toilet training. Once they have it, even if you started working on it when they're 3 and they don't get it till they're 5, not that I'm saying it's going to take that long, and then at 5 you're thinking, okay, I really want him to say restroom now. It's going to be easier for them to transition because they already got it down. You know, they understand what that is.
Right. We don't want to give them too many things at once.
Yes, but if your child, if generalization is not a problem, if he understands that toilet, potty, all of these words are the same, then it doesn't matter. You can use all of them, and it's actually better to do that because they better generalize the skills. So
My children are much older, and we need now say, I'm going to the loo.
Oh,
Because that's
loo,
just-
huh?
Why not? Just throw another word in there, mix it up, kind of thing. So
Yes, sure.
and we to this day, as grown humans, we do this. So like if you're in a restaurant or
Oh, yeah,
something,
yeah, we do
you just
that.
look across the room and be like, because I mean, when your kids disappear in the grocery store and I'm like, wait a minute. You just go to the restroom. You know, I think it's a handy skill.
You
I think it's a
have
handy
to go with the environment, and because we're talking about the environment, I just want to make sure to mention that one of the big things is, you know, is my child, should they stand or sit if it's a boy? And with autism, right, we have a lot more boys than girls. So when I started as a new therapist, I used to always think like, okay, well, let's have them sit because it's easier, right? They're going to be there for a little bit and it's easier to have them sit than stand. And that's how I did it, I think, for a few years. Until I realized it's really important to bring in the component of getting the family to have a say in that.
Right.
Because we toilet trained, we had Mom was working with me mostly because I was at work. And so we were so excited when we toilet trained him, and then we taught him how to stand up. We were like, yes, he's finally going pee-pee in the potty, standing up. And Dad had the day off of work, so we were showing him, and he was like, well, he doesn't need to stand up to go to the bathroom. I sit down when I go to the bathroom. In fact, surveys show that 36% of men sit down when they go to the bathroom. So it was a topic of discussion for the family.
Right.
My lesson with that was, let's make sure everybody's involved, especially if there's going to be a man in the house and we're teaching a boy, really with those discussions, because maybe we spend too much focus on that, like transitioning him because for this child, that change was different.
Sure.
To be able to stand, and then they could have a conversation as a family if that's something that they even wanted to address. And maybe for other families that might not be the case, but it's always just really also an opportunity to make sure everybody has buy-in, and they're like, at least I had my 2 cents, I had an opportunity to really talk about it. Right. And so it's that toilet training plan, which if we don't have any questions yet, I'll kind of want to go through some other things to think about. So definitely the time of the day when they're going to be wearing underwear is one thing that we really need to be thinking about. We recommend wearing underwear at least during daytime, and then you could always work at nighttime later, but some kids do great working day and nighttime. It depends.
And even if they don't want to get rid of the diaper, you can put the underwear under the diaper so that the underwear is against the skin, and they're going to feel that wetness or that dirtiness a lot more robustly, so that there's not something, like you said, wicking it away.
Because diapers now are so wonderful in absorbing moisture, right? It's because we don't want our kids to be uncomfortable. Right. But we actually do want our kids to be uncomfortable.
That's kind of the key to starting it.
When we're working on toilet training. So yes, thank you for bringing that up. Is there going to be a time where they're going to be wearing pull-ups or diapers? And if so, when? Is it going to be that transition? They're going to school, so they're riding the bus. They're going to put it on when they get there, and they're putting, just really have time opportunities to talk about that. And realizing, like, yes, it would be ideal for wearing underwear the whole time, but also what's really going to work for that?
What's realistic for the
is it realistic
for 45 minutes or an hour?
And
it's not
the bathroom's not going to be available. Yes, all of those things.
It's an hour on the bus for some kids, unbelievably.
That's
a long time to be in underwear.
Long time. And then definitely before you start, as you're thinking about toilet training, you want to determine how long is my child staying dry for, so that I know if I'm going to start with a schedule kind of is how long am I going to make that? I think that earlier I arbitrarily said 30 minutes, right. But it depends. So we kind of take some data. We can kind of be checking our kids. We do what we call these dry pants checks, where we say, okay, I'm going to be checking my kid. Let's start with every 10 minutes. And so every 10 minutes I just say, are you wet or dry? We can have them check. And if they're dry, then we know, and then we can see, oh, look, it's like right here. They're like an hour. Or you know what? Every 10 minutes that I'm checking, he's wet. He's really not even holding it at all. Right. Which, if you want to talk about readiness, especially if your child's young, maybe that's something to consider. But at least if your child's actually able to hold it for an hour, then there's no reason to do 30 minutes. Right. Take them every hour. Right. The less often you have to take them, the less work we have to do.
So I want to get to a couple things because we're running low on time. I think we have a few minutes left. That one of the greater challenges for families and children with autism who are toilet training is, again, it happens with neurotypically as well, like they don't like the sound of the flush or the echoey bathroom or some of the sensory issues that are happening, not necessarily the sensory in the diaper, but the environment of that restroom. And how can we help families with that? And even I'm sure that one of the greater challenges is when parents are working on this and they go into a restroom and they're in the stall with a child and the child's screaming or making utterances because that's their echolate, or like how do you help parents to manage that and to be confident in what they're doing so they don't just say, I'm not going to do it. I think that's learning.
I put a pull-up on to go to Target, always, because it's too loud. is maybe what
That's what you're saying. That's what I'm asking. Like, what is that an amiable solution? Like, how do you help parents navigate that part of?
Well, definitely when you're going to be, toilet training, we often focus on the home. And then once you kind of get it down, it's going out in the community, because it can be a lot more difficult to do that. However, as long as you go out into the community, and if you're at HEB, for example, when you get there, if you show them where the bathroom is, so that way they know, because some of our kids, even though we're going to be working on saying or signing, they might not initiate. But at home, what we start seeing a lot is they'll start going towards the bathroom. So that's their initiation. So we want them to have an opportunity to do that. Or if the sensory overload is too much from going to Target, maybe that's when you don't work on it. And I think that was Adrienne's point. But Adrienne, she's our sensory guru, so I'll let her talk about how we can handle some of those sensory issues in the home.
In the home.
I'm sorry.
Yes.
We're really running low on time.
Yes. Okay.
I want to try to tackle. I feel like you guys have done really great on the home. It's that community. That's the because that's where all that social anxiety comes. Not just for the child, but it comes from the caregiver as well.
So let's talk about that.
That's what I want.
Really quickly. What I think is invaluable is systematic desensitization, which means looking at social stories, watching a YouTube video of the bathroom at Target. Go and make one yourself. Maybe the cleaning crew is in there. You can come in and make a video of what it looks like at the bathroom at Target. What it sounds like when I turn on the hand dryer. And if you make a video, you can turn the volume down when you're showing it to your child. So then you can systematically each day turn it up a little bit more, a little bit more, a little bit more. Have a picture cue that the hand dryer is loud, but it's okay because I have my noise reducing headphones that we're wearing to Target in case I need to use the restroom. So those are some ideas for the sounds in the restroom. Even AirPods that are not turned on can muffle sound. So you don't have to have large aircraft looking headphones on your child. Some people maybe don't like how that looks, or children may not like how they feel, but they associate the AirPods with, when I watch my favorite video, I have earphones in. So they're desensitized inside their ears now to be able to go into the restroom. Smells, you can use eucalyptus or peppermint essential oils, or even Vicks Vapor Rub if they can handle that on their chest, or just a tiny bit below their nose, so that it will take away the smell that's in the restroom that may be unpleasant to them. And then lastly, with washing hands with soap and water, you can take a towel from home with you and maybe scrub their hands first with a dry towel to desensitize the hands. Even bring a little packet of soap that has maybe some of those scrubby beads in it. That's a little easier to have on their skin than that really slippery hand soap, so that they can feel like they're more comfortable in public because you've brought some things from home that can help desensitize their hands.
And really, if that's a big challenge for them, the hand washing, if they're out in the community, I would say start with your goal being they actually go in the bathroom, in a new bathroom, and then maybe if they're fine with hand sanitizer, you just hand sanitizer, you're done. Like you tackle one thing at a time, because it can be a lot of steps. But really, really important is to do take a step every day. Take a small step. And when we try to take big chunks, it can really be a lot on parents and the child. Everybody's stressed. But if you're saying, I'm going to make little steps every day, it's going to really add up.
Absolutely.
And I have to say it as a behavior analyst, take some data. Sometimes it can be really difficult. You're putting so much time into it and you're like, I haven't seen him make any changes. I feel like he's the same. So then you go back and you can see, when we started a week ago, he was only going to the bathroom once. And now we're at twice. That's a change.
That's
from
progress.
1 to 2 in 1 week. Let's keep going. Now, if you don't see a change, that tells you, let me do something different. But sometimes when we're making small progress, it's hard to feel it, to just ask somebody, and what do you think? And we need to see it with numbers, especially for kids that make slower progress. And we do sometimes have our kids that it's a really slow start, and then they get it, and it's like big gains.
Big jumps.
But that initial, to get you going, to get you motivated, to put in that hard work, because it is a lot of hard work to toilet train children.
It is. I think I want to thank Adrienne and Dr. delaCruz and Autism Community Network for hosting us today. I really do think, and potty training classes, thank you. Our Any Baby Can of San Antonio, who's one of our Autism Lifeline Links partners, has potty training classes, as well as Autism Community Network has potty training classes. So you can go to their websites, or if you are a parent or a person with autism, please go to autismlifelinelinks.org and register. If you are already a member, you can reach out to your care coordinator and ask them to do a referral to you to one of those two agencies, and we'll get that off your plate. So you can always engage your care coordinator and ask them to do that referral. I think that the messages are always, I try to say when we're having these Facebook Live events, is parents, cut yourself some slack. You're doing a great job. Continue doing that. Know that there are resources in the community to help you, and whatever doesn't exist, let us know that, so that we can, as Autism Lifeline Links and all of our 14 partners, try to make sure that we are changing that system of care for our community. But also, having that plan it's paramount. I actually got into this with my 18-year-old this morning at 5 o'clock this morning at the gym, which was plan, right? Be your campfire girl, be your girl. Make your plan, because making that plan is going to make things a lot less cumbersome and stressful for you as the caregiver, and for your child whom you're trying to potty train, and anybody else that's
and
helping you in that
think
journey.
About all those steps, so that you can be very clear to your child about what the expectation is. Because sometimes if you're not sure, that only frustrates our kids even more. They're already working on something difficult, and so if you think about all those steps and make sure to communicate them to your child, depending on their level, but you still have to communicate it. You just might have to be more creative about how you're going to explain it to them. It might need to be a visual schedule, or whatever that might be, but it makes you be a better teacher.
Absolutely. We think we think, walk into the bathroom and go to the bathroom, but actually no. There's getting in there. There's taking your pants down. There's like 5 steps, and for very concrete people and even small humans who are just developing, everything's a step. So exactly.
And we're going to be less stressed as caregivers if we have a list and they pick up on, are we stressed and they feel stressed because we are, or are we relaxed and we've got this and we feel confident? They're going to pick up on that as well.
Well, thank you very much, ladies, and Autism Community Network for hosting.
Thank you.
And thank you, Any Baby Can, Southwind Fields, Down Syndrome Association of South Texas, and of course, Autism Lifeline Links and Autism Community Network for streaming us live on Facebook. And we will do these every month, and we'll see you next month. Thank you.
Thank you.